Understanding multiple sclerosis (MS) is crucial. It is a condition that affects millions of people worldwide, and gaining a deeper understanding of it can help in managing the disease more effectively. Multiple sclerosis, or MS, is a chronic autoimmune disease. This means that the body's immune system, which normally protects against infections, mistakenly attacks its own tissues. It affects the central nervous system, which includes the brain and spinal cord. The central nervous system is responsible for sending signals throughout the body, and any disruption can lead to significant issues. In MS, the immune system mistakenly attacks the protective covering of nerve fibers called myelin. Myelin is essential for the proper functioning of the nervous system, as it helps in the efficient transmission of electrical signals. This attack disrupts the flow of information within the central nervous system. When myelin is damaged, the communication between the brain and other parts of the body becomes impaired, leading to various neurological symptoms. MS can cause a wide range of symptoms, including fatigue, vision problems, muscle weakness, and difficulty with balance and coordination. These symptoms can vary greatly from person to person and can change in severity over time. The exact cause of MS is unknown, but it is believed to be triggered by a combination of genetic and environmental factors. Researchers are continuously studying these factors to better understand how they contribute to the development of the disease. There is no cure for MS, but treatments are available to manage symptoms, slow disease progression, and improve quality of life. These treatments can include medications, physical therapy, and lifestyle changes, all aimed at helping individuals with MS lead fulfilling lives. COVID-19 vaccines are designed to protect against the SARS-CoV-2 virus, which causes COVID-19. These vaccines work by introducing a harmless piece of the virus to the body's immune system. This training allows the immune system to recognize and fight off the actual virus if a person is exposed. COVID-19 vaccines have been shown to be highly effective in preventing severe illness, hospitalization, and death from COVID-19. The vaccines are available in different types, including mRNA vaccines and viral vector vaccines. People with MS have weakened immune systems, which means their bodies are less capable of fighting off infections and diseases. This makes them particularly susceptible to various illnesses, including the highly contagious COVID-19 virus. Making them more vulnerable to infections, including COVID-19, can lead to severe complications. This is why it is crucial for people with MS to take extra precautions to protect themselves. COVID-19 vaccines are considered safe and effective for most people with MS. These vaccines have undergone rigorous testing and have been shown to provide significant protection against the virus. The vaccines work in the same way for people with MS as they do for the general population. They stimulate the immune system to recognize and combat the SARS-CoV-2 virus, which causes COVID-19. By helping the immune system recognize and fight off the SARS-CoV-2 virus, the vaccines significantly reduce the risk of severe illness, hospitalization, and death. This is especially important for people with MS who may already have compromised health. It's important to note that COVID-19 vaccines do not worsen MS symptoms or increase the risk of relapse. Studies have shown that the vaccines are well tolerated by people with MS and do not interfere with their ongoing treatments. In fact, getting vaccinated against COVID-19 is crucial for people with MS to protect themselves from potentially serious complications. Vaccination not only helps in preventing the initial infection, but also reduces the chances of severe outcomes if they do contract the virus. Therefore, it is highly recommended for people with MS to get vaccinated and stay up to date with their booster shots. Leading health organizations, including the National Multiple Sclerosis Society, NMSS, and the Multiple Sclerosis Association of America, MSAA, recommend that people with MS get vaccinated against COVID-19. Studies have shown that COVID-19 vaccines are generally safe and well tolerated by people with MS. The vaccines do not appear to increase the risk of MS relapse or worsen existing symptoms. Some people with MS may experience mild side effects after vaccination, such as pain at the injection site, fatigue, or headache. These side effects are usually temporary and resolve on their own. Section 5. Addressing specific concerns. Disease-modifying therapies and relapses. Some people with MS may have concerns about how COVID-19 vaccines might interact with their disease-modifying therapies or DMTs. These concerns are valid, as managing a chronic condition like MS requires careful consideration of all treatments and their potential interactions. DMTs are medications that help reduce MS relapses and slow disease progression. They work by targeting specific parts of the immune system to prevent it from attacking the nervous system. This can help manage symptoms and improve quality of life for those with MS. Research suggests that most DMTs do not significantly affect the safety or effectiveness of COVID-19 vaccines. This means that people with MS can generally receive the vaccine without worrying about it interfering with their ongoing treatment. However, it's always best to consult with a healthcare professional. However, it's essential to talk to your doctor about the timing of your vaccination in relation to your DMT schedule. Timing can be crucial, as some DMTs might need to be adjusted to ensure the best possible outcome from the vaccine. For example, some DMTs may need to be temporarily paused around the time of vaccination. This is to ensure that the immune system can respond effectively to the vaccine, providing the best possible protection against COVID-19. Your doctor can provide personalized guidance based on your specific situation. They can help you understand the best way to manage your DMTs and vaccination schedule, ensuring that you receive the maximum benefit from both your MS treatment and the COVID-19 vaccine. Always keep an open line of communication with your healthcare team to address any concerns or questions you may have. Section 6. Recommendations from health authorities for MS patients. Health authorities, including the Centers for Disease Control and Prevention and the World Health Organization, strongly recommend that people with MS get vaccinated against COVID-19. They also advise people with MS to stay up to date on recommended booster doses. Booster doses help maintain a high level of protection against the virus over time. It's essential to follow the latest vaccination guidelines from reputable health organizations, as recommendations may evolve based on new research and emerging variants. Section 7. Making informed decisions. Your health, your choice. Getting vaccinated against COVID-19 is a personal decision. For people with MS, it's crucial to weigh the potential risks and benefits with your doctor. Your doctor can provide personalized advice based on your medical history, current medications, and any concerns you may have. Don't hesitate to ask questions and seek clarification on any aspect of the vaccine. Remember, staying informed and engaged in open communication with your healthcare provider can help you make the best decision for your health and well-being. Section 8. Navigating the future, ongoing research and monitoring. Research on COVID-19 and its impact on people with MS is ongoing. Scientists are continuously studying the long-term effects of the virus and the effectiveness of vaccines in different populations. Staying informed about the latest research findings and recommendations from reputable sources can help you make informed decisions about your health. It's also essential to continue practicing other preventive measures, such as hand washing, mask wearing, and social distancing, to minimize the risk of infection. Section 9. Key takeaways: protecting yourself during the pandemic. COVID-19 vaccines are generally safe and effective for people with MS. They can significantly reduce the risk of severe illness, hospitalization, and death from COVID-19. It's essential to talk to your doctor about the best time to get vaccinated, especially if you're taking DMTs. Staying informed, following recommendations from health authorities, and maintaining open communication with your healthcare provider are crucial for protecting your health during the pandemic.